I'm going to do a really short little 1-minute video to introduce myself. Here I go.
With decades of experience as a leader in innovative alternative therapies, Dr. Siegel inspires, motivates, and empowers pet owners to create sustainable lifestyles for their pets and their families. Dr. Siegel is an award-winning author, keynote speaker, teacher, researcher, motivational coach, and out-of-the-box thinker. She discovers solutions when others give up by incorporating innovative technologies. Her passion and commitment are evident in her tireless efforts to educate clients on the importance of healing the root cause of disease. She shares her 3 decades of experience through TV, radio, podcasts, blogs, and hand-on programs. Dr. Siegel is featured in the documentary The Truth About Cancer, Pets, with Ty Bollinger. She helps pet parents and doctors shatter limiting beliefs and enter the realm of possibility. She is the founder of Pasco Veterinary Medical Center in Lutz, Florida. Please put your hands together and give a warm welcome to this fire-eating veterinarian who's changing the world one person, one pet, one thought, and one action at a time.
Good morning. All right, you've got to answer me or I'm going to think you're asleep. Okay, we all here? All right. I want to talk a little bit about opportunities. And what does opportunities mean? Raise your hand if you've ever had a challenge in your life. And I'm talking about those challenges that move you in a new direction, they change you personally and professionally. So we've all had those experiences, but here's the key. When you had that experience, were you a victim? Did it stop you in your tracks to where you really didn't make use of that? Or did you take the opportunity to become the victor? Did you find the gifts and the blessings that were in that experience that enabled you to take that next step into that bigger, better version of who you are and why you came here? My promise to you today is that I'm going to help inspire you to look at those missed opportunities and go back and pick them up. Mine came when the Western medical world failed me trying to heal my horse. And that made me look in other directions. We have all had a phenomenal experience in Western medicine. No one at all questions that. But we need something different now. We are in a different world, we have different challenges, and we can no longer live in a world where we are dealing with steroids, antibiotics, chemo, radiation, and surgery as our only tools. Agreed? We've exhausted all conventional measures. One last desperate option is to put you on an alternative natural medicine that has a 96% success rate. I really think that sums it all up. And ozone is that one tool that is going to be a game changer in your practices. Okay, fear. What is fear? And it is something different for everybody. I define fear as future events appearing real. So when I ate fire, do you know what the scariest part, the most difficult thing I had to face when I was eating fire? Anybody have an idea? Raise your hand. I heard something in the back.
Your own fear?
Yeah, the event appearing very real, and there was a fireball coming at my mouth. What was so difficult about that experience was the anticipation of the experience. So I'm thinking, how am I going to make it in my mouth? Now seriously, for 60 years, I didn't miss my mouth, and I didn't think about it. But all of a sudden, there's a ball of fire coming at my mouth, and I'm thinking, what if I miss? What if I light my hair on fire? What if? And that 2 hours that we were prepping before we got to eat that fire was horrible, because you imagine everything that could go wrong. And isn't fear the thing that holds us back in our lives? In our professional lives, when we go to take a new course or have a new modality, and you're wondering, well, what if my clients won't pay for it? What if my staff doesn't support me? What if I can't learn it? What if it becomes that tool that collects dust in the back of the office? We all have those fears. But those are limiting fears, and I want you from this moment forward to step into your power and realize that fear is only what you project it to be in the future, and it is not your reality. So, we hear a lot about all the scarcity that's going on in the world. Seriously, there are over 60 million households in the United States that have dogs. And there are over 47 million households where a cat shares their space with us. No cat owners here? Okay. So what does that mean to us? It means that we have lots of opportunities to be able to stretch past those limitations and to really make a big change in the world. We no longer have pets. Have you noticed that dynamic that has shifted with our clients? We have soul pets. These people have stronger bonds to their pets than they do some of their two-legged family members. Agreed? And they'll do things for their pets that they wouldn't do for themselves. And I find that interesting because we have a lot of very unhealthy people coming in with their pets. And when we talk about diet change, environmental change, reducing the toxins, and they stop about halfway through the presentation, they go, would that be good for me? And you go, yeah. But they're willing to make the changes for their fur baby. Alternative medicine is really not new to our clients. In 2006, Colorado State University did a survey, and they found that over 50% of pet owners back in 2006 were already looking for alternative approaches and using them on their pets. In 2018, there was a survey, and they found that 50% of pet owners had more confidence in holistic, organic, healthy food than they did the commercial products. So they are way ahead of us on that curve. Now, we all have, anybody in here do surgery? Right? Not all hands went up. Do you remember ever doing surgery? Okay. When you did, how many instruments were in your toolkit, in your surgery pack? Raise your hand, just shout out some numbers.
30.
Okay, I'm hearing 30. I'm certainly not hearing 1, right? When we practice alternative medicine, we should have as robust of a toolkit as we do in our Western medicine practices. Don't limit yourself to 1 or 2 modalities. This is just some of the stuff that I do in my practice. I do acupuncture, I do ozone, I do magnetic resonance, which is a PEMF device. We have 3 different kinds of lasers, and I'm about to buy a 4th. Chiropractic work, molecular hydrogen, Theragen, light frequency, salt booth therapy, live blood analysis, thermography, infrared saunas, herbs and oils, high dose vitamin C, B17, homotoxicology, hyperbarics. We do a lot of stuff in order, oops, I shouldn't have done that. We do a lot of therapies because it doesn't, the diseases that we're seeing didn't occur with one thing. These are multimodality diseases, and I call it polymedicine and polytherapy. But when you're trying to get ahead of a really challenging case, you don't want to be limited to one tool. You want to have as many things as possible. However, you can pick those most robust tools in your toolkit, and in my opinion, in my practice, Ozone is my #1 tool that is pulled out for every case that has inflammation. Anybody treat a cat over the age of 30? Raise your hand. No raised hands. But there is a cat in the Guinness World Book of Records that is 38 years old and 3 days. And there was another cat in that household that was 34 years old. Now, is that an enigma? I don't think so. I think that's what should be the norm. And I think the enigma is the fact that our cats are dying between 8 and 14 years of age of kidney disease and cancer. That is not acceptable. This is Mackie. She lived to be 30 years old. Anybody see a dog in their 30s, right? This owner attributed her longevity to #1, she did intermittent fasting on her own. She worked hard every day. She was on a dairy farm. She ate placentas and drank raw milk. She was a happy dog. Again, I don't think these are enigmas. I think these should be our benchmarks that say, this is possible. Remember when the guy said that you can't do a 1 minute mile and under whatever that time was, and then somebody broke it, and after that everybody broke it. We need to be breaking these records. Our clients are expecting this, and we should be able to provide that. You know what the average age for humans is? You know what it should be?
Yes.
Take a wild guess.
200, 250.
Actually, 120 is what the average age of people is on the chart supposed to be. And we're dying at 78 and change. So I don't think we're doing a good job there either. Who saw The Matrix? Right? The red pill, the blue pill? Well, that blue pill, for those of you who didn't see The Matrix, is taking the information that others want to feed you about what the world should look like in their perspective. And then the red pill is the world that we see, which is reality. I had to take that red pill one day because I no longer could find the answers that I needed in the Western world. Would you like to know why I took that red pill? No answers? Well, I won't tell you the story if you don't want to hear it. It's a fun story. Would you like to hear it?
Sure.
Okay. So, number one reason why you should listen to me, I'm a practitioner just like you. I am not board certified in anything. I live in the trenches. So I know what it is that we're facing. I have the same clients, we have the same challenges, and I'm telling you, there are answers out there, and they're available to us through companies like O3 Vets. So, is it a surprise that my red pill involved an animal? No. This is Demi, my youngest daughter, and Lily, my English show horse. Demi was 8 and Lily was 7 when my world as I knew it changed. This team was very, very special. They weren't just horse and rider, they were best friends. They were almost undefeated at the local, regional, national levels. And then there was that show where something went very, very wrong. They had come into lineup, and I knew they'd already lost their class because Lily, very uncharacteristically, had cantered twice in a walk-trot class. So I knew she had lost her class. But I thought that was the scariest part because my little 8-year-old had never cantered before. That's a big mare with a very big gait. And she didn't freak out, she didn't fall off, she actually got her horse back under control. She actually rode her horse, which was really cool. And they're back in lineup, they're standing with their trainers in front of them, and all of a sudden I see Lily acting like something's attacking her neck. And the trainer saw it too, and she reached her hand up to fix it, and that was when the unthinkable happened, and Lily reared straight up in the air. Now, no one had ever told my daughter what to do if your horse rears. So, while Lily was flailing and trying to get her feet down on the ground, Demi was literally hanging from the reins, trying really hard not to fall off. The number one cause of death to riders when their horse rears is the horse falling and crushing on them. There was not a breath in that arena as everybody watched that scene in horror. It's really hard to even talk about it. It was 13 years ago. But the emotions as you watch that scene unfolding, knowing how tragically that could have ended. But instead what happened was, as Demi was falling to the left of the horse squatted on her left hind leg and as hard as she could tried to push herself in the opposite direction of where her little buddy was falling. When Lily hit the ground, that thud reverberated through the entire arena. You couldn't see if Demi was crushed or trapped. Took a couple seconds for Lily to catch her breath, and when she did, she struggled up, but Demi still lay on the ground not moving. I don't remember jumping over the arena wall, but I was running towards my child. And by the time I got there, it was by the grace of God that I discovered that the only thing she hurt was her pride. I know, it was really hard. It's hard for me to get through that story, and I have to say it pretty often. So that wasn't the end of the story though, because back at home, Lily had 2 more of these episodes where her neck went into spasms. And I had equine veterinarians come out and look at her, and they said, Dr. Siegel, I don't know why she's having these, but she's not safe to ride, and you'll never show her again. She was 7 years old. She's a US and Canadian national champion. This horse could compete against the big boys, whomp them, and then turn around and take an 8-year-old child around that arena safely back into the winner's circle. More importantly, she had saved my daughter's life. And hearing that my 2 options were I could put her out to a pasture or I could put her down was absolutely unacceptable. I said, if you don't have the answers, I will find answers elsewhere. And that's when I took my red pill and I moved into the world of alternative medicine because Western medicine didn't have anything for me, which I know you all appreciate because you're in this room. We're at a holistic conference. So somewhere along the line, each of you had a story that made you leave that Western training and seek something else. 5 months after being told she would never be able to be ridden again safely and never be shown, Demi and Lily went on to win the United States Youth National Reserve Championship, the most prestigious show for youth riders in the entire country. So don't ever let anybody tell you there's nothing more that can be done. I worked on this horse every day. She had multiple people helping in a variety of different venues, and she still lives on, happy and healthy, at her forever home in my backyard. So I want to share with you what I have learned to be my 5 principles of healing, because there is no tool out there that is going to be the one-step answer for everything. And I think we live in a world where we've been taught that everything is fast, cheap, and convenient, and that's not reality. That's your blue pill world. But in the red pill world, we know that we can't keep doing the same things over and over and expecting a different result. Agreed? Are you guys awake? All right. So, number 1, we have to stop polluting the body, mind, and the spirit. You can't keep putting all these toxins into the food, into the water, into the environment, and expect anything, including ozone, to be your one fix. Number 2, we have to provide all the essential nutrients that the body needs to do its job. It's just that simple. We're eating nutrient-depleted foods, we're feeding that to our pets, and it's not working. Number 3, we have to heal the gut. I didn't really hear any talks today on the microbiome, but I don't think anybody in this room would deny how important that is. Number 4, we have to clean the organs of elimination. There are 6 very important organs that were designed to keep this body clean, and we are clogging them up unmercifully. So we want to make sure that we clean those organs of elimination. And number 5, this is where ozone comes in. We have to repair and restore the mitochondria. Why is that important? Because without the mitochondria, we don't make ATP. Without ATP, you don't hang out. We don't make telomeres, we don't have longevity, nothing goes on. You don't even make glutathione, so you have no antioxidants. Make sense? Okay. Now, we have been told for so long, when you go to the doctor's office and you have to fill out your health history, and they go, well, is there a history of cancer in your family? As if that is why you have cancer, seriously? We now know that cancer is 10% genetic and 90% environmental. Everybody nod your head that you understand that, because that's huge. So we're going to talk for a second about nutrigenomics. Everybody says, oh, well, where are the studies? We have a study now, because the University of Helsinki College of Veterinary Medicine, we did it in Finland, did a study, and they discovered that 30 to 40% of all cancers would be eliminated if we fed a species-appropriate diet. Number 1, epigenetics is the study of how DNA is affected by our environment. Everybody know the work of Dr. Bruce Lipton? A couple of people? Look up Dr. Bruce Lipton, has a ton of stuff on the biology of belief, which is free on YouTube, and it is a game changer for you. So it's your environment that is the number 1 indicator of what your gene expression is going to be. And then the last one that we're going to talk about more is called hormesis. Raise your hand if you have ever heard of hormesis. Okay, we have, I know Jonathan has because I thought. So we have a couple of people in the room. What is hormesis? It's the low-dose intermittent stressors that our bodies and our pets' bodies were designed to utilize in order to make more energy. So what does that look like? Well, if I put my arm in a cast, what would happen to the muscles in my arm? You can talk louder. You would atrophy, exactly. Well, our mitochondria are designed to be stimulated and to be working based on what we tell them, how we exercise them. So our ancestors had a life where they were exposed to extreme temperatures. When it was cold outside, they were really cold. And when it was hot outside, they were really, really hot. There were times where they didn't have food. They called it starvation. They had a lot of intense work. When they had to catch their food, they had to work really hard, whether they were running or whatever they had to do to get their dinners. And when there was neighboring tribes that were attacking them, they had to work really hard to defend themselves. So they did not have easy lives. And they didn't stay up at night with all their Wi-Fi and their toys. They got good sleep at night. What does our life look like in our modern times? We live between 68, 78 degrees all the time, except for when you walk from your house to your car and your car to your job and then back and forth. But other than that, we really aren't exposed to extreme temperatures. I think it's interesting that cryo booths are now coming out so that you can freeze yourself for 3 minutes. Not a bad idea, actually. Fasting, anybody in the room do fasting? A lot of you do fasting, and that is awesome because our bodies, again, were designed to have that intermittent stressors. But how many of us really want to face our owner and say, you need to miss a meal with your dog? No, it's not a pretty sight, is it? Because they really get upset about not feeding their animals. Most people and most pets eat an exceedingly large amount of food, and they eat it all the time. And it's nutrient depleted. So you're really not helping your body do anything. Sedentary lifestyles, getting up, going to the food bowl and back and out for a walk around the neighborhood does not qualify for high intensity activity. High intensity activity is the activity that you go absolutely all out for 60 seconds, you recover for a minute and a half, and then you do it again. I cannot get past my third round without puking, right? But you're making growth hormone, you're telling your telomeres to get longer, you're telling your mitochondria, exercise, get out there and get some extra work done. Very, very important. And we're all sleep deprived, right? My roommate came in at 2:30 in the morning last night and had to be up at 5. So how much sleep did I actually get? And we have Wi-Fi in the whole building. What is cancer? I have a new definition for cancer, and some of you may agree with this or have already heard it. It is a deficiency disease with mitochondrial dysfunction, and it's isolation of the cancer cells. They have lost their ability to communicate with the other cells. They become a rogue cell, and now they're out there without the rest of their army, and they don't know if there's going to be any help coming, so they're out there doing their own thing. Make sense? So how can we use this to our advantage? Well, we know that 99% of the tumors, the cells that are in a tumor, are easily killed. It's the 1% of the cancer stem cells that not only are difficult to kill, but when you do things like chemotherapy, it makes them very angry. And then they mutate and they come back with a vengeance. Radiation and chemo, they kill all that 99% really easy. It's almost anything you can do could kill them. It's the cancer stem cells that are really the challenge. And again, that's where ozone comes in, because ozone is very effective against the cancer stem cells. All right, so what are our solutions? Number one, stop doing the pollution, supply all the essential nutrients the body needs, restore mitochondrial function, and restore intracellular communication. It's not a hard concept. I'm going to show you some cases in a couple seconds here where we were able to do that and have great outcomes. So what are the effects of ozone? Well, number one, ozone is a pro-oxidant. So it's going in there, increasing oxygen, it's increasing the antioxidant stimulant. Now this is really important because we live in a world right now where all the rage is about eating all the antioxidants. Well, let me tell you, you can eat all the antioxidants that you want. If you don't turn on that internal antioxidant mechanism, you are not going to go very far down that road. It activates the immune system. It is an analgesic. It is anti-parasitic, antifungal, antibacterial, and antiviral. So we had somebody ask a question in our lab. We have a flask and we bubble ozone through saline. And they go, well, how do you sterilize that so you can put it back in? Because ozone kills everything. There's nothing left in there. And it detoxifies. There's a couple quotes I want to put up here, and they're really worth reading because we have lost the ability to recognize simple, easy tools that nature provided for us. We didn't make ozone. Nature made ozone. We're just utilizing it in a way that we can use it in a medical fashion. So, in all serious disease states, we find a concomitant low oxygen state. We know that cancer does not grow when there's a lot of oxygen. So low oxygen in the body tissue is a sure indicator of dis-ease. Hypoxia, or a lack of oxygen in the tissues, is a fundamental cause for all degenerative diseases. And what is the underlying cause of all dis-ease? Is inflammation. One more quote. Dr. Schallenberger is probably one of the godfathers of ozone, and he says that ozone stimulates and stabilizes rather than suppressing biological functions. Do you understand how important that is? Everything else that is in the Western world is trying to suppress things. It's trying to suppress the immune system. That's not taking care of anything. Instead, it induces the body's innate healing mechanisms to create the healing effect. Thus, unlike medications and herbs, it can successfully be used essentially in every medical condition, regardless of the diagnosis. So anybody I've already talked to about ozone, I'm telling them that if they are not pulling out that ozone for every case, minus the healthy animal that came in for a wellness check, and even then, wouldn't it be good to have a hormetic stressor that turns that body back on? I think it's really important. I don't have any major challenging disease in my body right now, thank God, and I do ozone rectally on myself at least once or twice a week as a pro-oxidant, because I want my body to be stimulated. I want to turn those mitochondria on because I know the key to my health and my longevity depends on that, and I'm in my 60s. So it's really important to me not having health care. I do not have insurance, and I haven't had insurance for over 20 years. I am not going to go to a doctor. All right, so how do we use ozone? There are a plethora of ways that we can use ozone. One of those ways is a condition that we call major autohemotherapy, and that's where we draw some of the patient's blood, we ozonate it, and then we put that back into their body intravenously. It's an extremely effective tool for helping to go systemically. We also have minor autohemotherapy, where we take a much smaller volume of blood, we mix it with ozone, and then you can inject that into an acupuncture point, you can inject that into a lesion, you can mix homeopathics in it. I have a combination that I like to use where I put gallium heal and viscous comp, I still have some, and I can inject that back into a tumor, or I make a remedy with the tumor, and I put all that together and I inject the animal. We also have limb bagging, which is where you have something on the extremity that you can fit into a special ozone bag and you can pump gas into that. We have a saline flush, where I'll show you a case where we had made ozonated saline and we put gauze down and we soaked the animal in the ozonated saline. We can put it in the eyes, we can use it rectally, we can do it subcutaneously, you can drink it, we can use it in dentals for lavaging before and after extractions. I use it at least 2 or 3 times a week as an oral rinse. So lots of uses, it's really up to your imagination.
Got about 10 minutes.
Okay, the value of one more day. Sometimes we wonder, why are people spending all this money on an animal that is ultimately going to die? Sometimes in a few weeks, sometimes in a few months, or sometimes in a year. Have you ever lost anybody in your life? Somebody very, very dear to you? Raise your hand. Okay. What would you give to have one more day with that person or that pet? Think about that. That's what our clients are asking of us. Not to judge them for their choices, but to give them that little bit extra quality time. And ozone is one of those tools that can give you that. I had a little dog that came in, I'm in Florida, they drove all the way from Texas, they had seen the truth about pet cancer, and their dog had just been diagnosed with lymphangiectasia. He had no ability to put on any weight, he had chronic diarrhea, he was really, really sick. And they drove this dog down. He comes into my office almost comatose. Now, she was treated every day with ozone. She had IV, sometimes rectal. She had a gambit of things, from salt therapy booths to CBD injections. And that owner had 9 months of absolute quality time with her dog. And to her, that's wiser. It was worth every moment of it. This was a dog that came in with limping in the back leg. We took an x-ray and I went, oh, so in addition to our spinal problems that we have, this dog had some major masses in the abdomen. This owner did nothing. This dog was dead in 3.5 weeks. So what we're doing really does make a difference. This is a dog that was referred from another veterinarian. The dog was paralyzed, wasn't able to empty his bladder very well, so he developed a resistant Pseudomonas infection. We were doing a urinary catheter, injecting ozone gas into the bladder. Within 2 treatments, we had no more Pseudomonas. That was gone. The dog's quality of life was extended. But I saw something on the x-ray when I took the x-ray to see if the owner was emptying the bladder well enough, and I went, oh, that doesn't look good, and we had an osteosarc. So we were able to extend this dog's life 3 more months when the radiologist had come back and said, that dog's not gonna live another 3 weeks. This is little Max. Max was somehow left outside without any shade. Max developed a severe sunburn on his back. When he came in, the office had to put on gas masks. I don't remember ever seeing a wound that smelled this bad. So here we are working on ozone, ozone topically, ozone intravenously. He got worked on every day. He was in the salt booth. He had all kinds of therapies being done. We can see that he was going to slough his back like a turtle. And I know you're eating breakfast, but we got a little short video to appreciate this. Our technicians would really like that, okay? My daughter's my technician, and she was like, oh, Mom, can I lift it off yet? She was so excited. All right, so that was his back. This is what it looked like every time we did an ozone treatment. Here was Max starting to heal. We had a nice granulation bed. And with our therapies, he went from the left to the right in 1 week. Once we got all that dead skin off, which really only took us about 10 to 14 days. And then he moved back to Georgia, and we don't have any post pictures. Snake bites. I don't know if you're living in an area, we see a lot of snake bites. And you can see the swelling on the left and on the right. It would have been less than 36 hours, but the owner didn't send me the picture, so I wanted to be absolutely honest. But this is the live blood. If you've never done live blood on snake bites, they get echinocytes in every red blood cell. So it's a good hallmark to know if it was really an insect bite or a snake bite. And 18 hours later, that was the live blood. That does not happen with antivenom. The only 2 things this dog had was antivenom and IV ozone. So her remarkable recovery was, I truly believe, more attributed to the ozone than even the antivenom. This was a cat that came in, a feral cat with upper respiratory tract infections. Owner didn't have a lot of money, so we did rectal ozone, ozone in the eyes. We did a saline flush with ozone into the eyes multiple times throughout the day. The ozone was every day in the rectum. He was in the salt booth, no antibiotics, and we changed him to a raw diet, got him on some kefir, so we had some good probiotics going in. This was him 24 hours later. A lot of the symptoms were resolving. He was starting to eat, and that's him in 3 days. We were able to neuter him and send him home. Okay, ear infections. Anybody's favorite? You know, we're seeing more of these Pseudomonas and E. coli resistant infections than we've ever seen in our careers. So we use ozone rinsing in the ears. So you can either do a gas and bubble it in. Jonathan has a little system where you can actually pump the gas in, or we do it as a rinse. And then we use a laser with a blue light to kill the bacteria. So we have 2 methods of killing them. The only dog that I got him cleared up every time we did it, but he kept relapsing. Turns out that she was spraying glyphosate all around her home where the dog walks every day. So that was, I'm sure, the underlying inflammatory part that was causing us a problem. It's a little deer that came in that had a fracture. She was hit by a car. She got rectal ozone, and we got her stabilized before we got her over to a rehab facility. This was Prolozone. This dog came in to be euthanized. Great Dane, not like a little guy that you can pick up and carry around, so he couldn't walk anymore. We did Prolozone in both stifles at the same time. This picture was taken 6 weeks later. This dog is still jumping in their bed. This is the last case, and this is the one that I'm so excited about to share, because a lot of times we get longevity, but we don't always see, I don't want to say the word cure, but let's say remission. Ratchet came in, had been at a referral center, was diagnosed with splenic lymphoma. I don't know if you can appreciate his ultrasound, but he had an enlarged spleen and all these mottle things in here, these hypoechoic areas. were aspirated, and they came back with a diagnosis from the laboratory of splenic lymphoma. So this is not some pie in the sky. We had a diagnosis. We started him on, first thing we did was his live blood analysis. And if you don't know what live blood is, come talk to me afterwards. But this guy's blood was sludge. Your red blood cells are supposed to be bringing in oxygen, picking up waste products, delivering it out. When you can't do that, you aren't effectively being able to help this dog metabolize, and that amount of oxidative stress is contributing to your problems. You're not going far if you don't get rid of that. So this was him after his first treatments, and then this was him 3 weeks later. And you could see him clinically respond as well. So we do an ultrasound 10 weeks later, and I was not privy to seeing those original pictures, so I was not biased. I just had a written report. I'm looking at this ultrasound as we're doing this late at night, and I'm not seeing any modeling. We send it to a board-certified radiologist, and he comes back and he says, you probably didn't have cancer because the spleen looks normal right now. So I got the referral pictures, and I sent them to him, and I said, what do you think now? He goes, well, it certainly looks like there was lymphoma in there. So I assume, in writing, I assume that this dog had steroids and chemotherapy between July and now, and that's why the spleen is normal. I was so proud to be able to say nope. And I told him what we did, and his one-line answer back was, wow. So there are lots of studies. Again, this is not a new technology. This is not a new science. This is a proven technology that is safe, effective, and cost affordable that you can do in your offices. Lots of studies to look up that are wonderful examples. I'm going to do a really short little video if we have time.
Maybe we should skip it.
We're going to skip the video. It was just different veterinarians who have been able to employ ozone into their practices and have very, very effective outcomes. And live longer, be better. That's your slide. So, you know, when we live our life with purpose, and we are intentional, and we take those obstacles that we're facing, and we say, wow, this is an opportunity for us to be able to go past that obstacle and find what is the blessing that you put that obstacle in your life for. Life is amazing. We were all taught in school, don't die without that silver bullet. And what was that silver bullet? Steroids. We have a new one. It's don't let your patient die without ozone.